Assalamu alaikum wa rahmatullahi wa barakatuh. Very good evening. Welcome to this week's edition of Health Matters. We focus this evening on overcoming COVID-19. We speak to an individual who has contracted COVID-19. We find out what the stats are and what people have said around the world with regards to being a patient and contracting the COVID-19 epidemic. So let's first kick off this week, and please do interact with us on our WhatsApp line. I'll give that to you in a moment. Let's look at the stats for COVID-19 in South Africa. So the daily increases, we're looking at 2,500, over 2,500. We now welcome our in-studio guest and in-house medical specialist, Dr. Shuaib Wadi. And we asked Dr. Shuaib to just enlighten us on today's conversation as we look at patients who overcome it, patients that have died. You know, the stats that's there, we've seen some of the numbers, the deaths, Western Cape being the epicenter, over 23,000 people being infected. And here in Gauteng, over 6,000. So let's look at where COVID-19 is right now within South Africa. The current lockdown is level 13. Level 3. And yeah, any update, Dr. Wadi?
Assalamu alaikum wa rahmatullahi wa barakatuh. Thanks, Khawa. So obviously, COVID-19 has now been with us for a few months. There's a lot that we've learned over the past 3 or 4 months, and a lot we still have to learn. What initially they thought was going to be limited to China and maybe a few sporadic cases around the world has obviously become a life-changing and world-changing event around the world, akin to a natural disaster which is dragging out over several months, if not years. So where we are now in South Africa, as you quite nicely pointed out in the video, is that we've got 50,000 plus cases now, of which the majority, close to 60%, actually more than 60%, I think about 65 to 66% are in the Western Cape. So about 33,000 cases in the Western Cape, which dwarfs sort of by 5 times the cases elsewhere in the country. You know, the next most affected place is Eastern Cape, and then Gauteng, which is very similar, with about 6,000 plus cases. So obviously the number of cases in the Western Cape where they're having a significant surge is testing the healthcare system in the Western Cape. For sure, the ICUs have been filling up. So one of the problems with COVID is that many patients will do very well. In fact, the majority of patients will do well and recover from the condition. About half of them seem to be, close to half of them, it varies in some series, seem to have little or no symptoms, actually no symptoms, even on detailed questioning. Another significant amount will have very mild symptoms, which can vary from a little bit of body aches, a sore throat, headaches, difficulty smelling, some gastric upset.
The taste buds also.
Yes, and similar type of symptoms which are well described now, flu-like symptoms and so forth and so on. So, and those people will get better. There's a small percentage, maybe about 10% of people or less, who will need hospitalization. So that's still quite a lot of people. If you're looking at 30,000 people who are affected in the Western Cape, or 33,000, that's about 3,000 that will need hospital around there, plus minus. And of those 10%, that will need, maybe 10 to 15% in some areas, depends on the testing strategy. And of those patients, a small number, maybe about a tenth of them, or 20% of those patients, will need ICU care or more aggressive care. And in the past, there was the feeling that a lot of these people will need ventilators because it affects the lungs. But what they have realized is that ventilated patients don't do very well. They tend to have very severe lung disease, which takes a very long time to recover. And then, obviously, if you can't get a patient off a ventilator quickly, they tend to develop many other secondary problems, including damage to the lung from the ventilator itself.
Sure.
So it becomes a difficult scenario to manage, and then these patients accumulate in the ICU over a prolonged period. So the idea is to try and keep them off the ventilator for as long as possible, and that's been one of the things we've learned over the last few months in the world, to do some things which we used to do to patients on ventilators, like try and turn them over and make them breathe and so forth and so on, to allow them to stay off a ventilator, and to use these non-invasive techniques like high flow oxygen and so forth. So I think the Western Cape is really sort of the opening gambit in what's happening in South Africa, and we're learning a lot around the country from what's happening in the Western Cape. The state, obviously the Western Cape has learned from what's happened in Italy and Spain and New York and so forth. So it does help us that we were able to come onto the peak in the surge later than other countries. And even Gauteng, it helps in Gauteng that we will follow the Western Cape, because we can learn from their experience, we can learn from some of the things that they did, some of the mistakes they made, and some of their successes. So those are the things that are happening in South Africa. Obviously, lots of patients are now affected around the country.
And of course, this is the discussion. It's overcoming COVID-19. If you've been positive, what is the process? What is happening? So we speak to patients, alhamdulillah, a COVID-19 patient who has recovered, although he had some underlying issues. And then also we chat to a family member, medical doctor, in fact, a family member of a COVID-19 patient that was positive, positive patient, but had zero symptoms. So we find that interesting, and we'll discuss around that, inshallah. And I know there's so many things to touch on now, Doc, with the mosques opening, with the schools opening. But today, let's focus on COVID-19. You can interact with us a little bit later on. Let's look at our video, our COVID-19 patients video. Take a look.
I'm still worried because they won't give me a second test.
I had the classic symptoms. I started off with a fever.
I had a mild fever.
The fever was quite constant for a few days.
I stayed in bed for 3 days until the fever broke.
I started getting fevers on the 8th day.
I was just dealing with the fever, but then it started to get progressively worse, and it got really bad.
And I started with the cough, the dreaded cough.
Every time I finished a coughing fit, it was the couldn't catch my breath.
I was lethargic. I could barely breathe.
I'm very short of breath. I'm unable to finish sentences.
It hurt so much inside my chest that I could not use my inhaler because I couldn't take a deep enough breath.
I was having like a knife pain to the chest.
Having these coughing fits that would actually make me keel over and feel like I couldn't breathe. I think that was the fear that I could die,
God, think you're going to die. It was not a pleasant experience.
To not be able to hug your child, to not be able to invite him into your home, just the devastation of the world that we now live in kind of hits.
There is, at this point, a very small percentage that does die. So, was I going to be part of that percentage?
The shortness of breath, that was really scary to me. So I called 911, and the EMTs came and they checked my breathing and checked my lungs, but they didn't take me to the hospital.
I was so uncomfortable. I was so panic stricken that I was like, all right, let me call an ambulance and get to a hospital because something's wrong.
My husband says, okay, I've had enough. I am taking you to the hospital that you work at to get care.
Suddenly, on the Wednesday, I just collapsed, really, and I had to be taken into hospital. And after, 12 hours or so, they did the test, and much to my surprise, I had the virus.
And so then I went to a testing center. I got tested, and then I found out I tested positive, and it's just kind of been a roller coaster ever since.
They stuck a swab up my nasal, very deep inside of it, and took a swab, and that was it. They told me to drive away.
I had to lie about some things. I told them that I had a pre-existing condition, and I came into contact with someone who tested positive. That wasn't true, but I really wanted to get tested and they wouldn't test me.
And then one day it just started getting better.
I'm doing good. I mean, I'm back to cooking and cleaning and exercising some.
And now I'm able to do things like donate my antibodies for research studies, which is very nice. So I do feel very lucky that I was able to get tested.
Take those precautions and take it seriously, because it certainly is not a fun virus. Not that any virus is, but people need to take it seriously because it's just continuing to grow like wildflower.
In terms of my mind and heart and soul, I'm 1,000 times better than I was a few days ago when I was in hospital. It's just, it's like coming from a black and white movie into a full color one.
So we hear from South Africans just after the break how COVID-19 had affected them, and in the epicenter of where it's really happening within the Western Cape, we speak to patients. Dr. Shoaib Wadi is in studio with us, guiding us on overcoming COVID-19. Please do interact with us on our WhatsApp line 063 959 0653 063 9595 0653. If you have any comments, questions and queries, stay where you are. We'll be right back. Assalamu alaikum, welcome back. This is Health Matters. Do catch our repeat tomorrow again. Tell your friends and family they can live stream on our Facebook page as well as itvnetworks.tv. I'm Hawa Solomon, co-hosting with me in studio, and our in-studio medical specialist is Dr. Shoaib Wadi. So please do join with us if you have any comments, questions and queries on today's topic, overcoming COVID-19. We speak to some patients, South African patients. Our WhatsApp line in studio 063 595 0653 if you would have any questions and you'd like to chat to us. So let's now link up with our recovered, in quarantine and very well patient. We have Yusuf Mali. Assalamu alaikum to you, Yusuf.
Rahmatullahi wa barakatuh. How are you doing?
MashaAllah, it's so good to see you, Yusuf. Welcome to the airwaves once again of ITV. How are you doing?
I'm doing brilliantly well, alhamdulillah.
MashaAllah. So Yusuf Mali, a father, husband, alternative practitioner, very much a herbalist, is also one of our colleagues, broadcaster and an entrepreneur, had contracted the virus whilst he was shopping, doing some essential grocery shopping, had a mask, discovered he had it. Hopefully it wasn't it, but you did pick it up. And we know that within the Western Cape, there's been comments around the surge of COVID-19 because of supermarkets, grocery stores, people being more social in Cape Town than other areas. So tell us, Yusuf, I've listened to your story. I've taken some notes. Very inspirational indeed. This happened during the month of Ramadan. Just when you had yourself tested, you actually had the sigh of relief. You were happy to actually find out, yes, you were sick because of COVID-19. But were there any other concerns or emotions that, sort of were brought up when you heard, yes, you're positive?
Well, yes, in particular because I do have a sickly and ailing mother. So my first concern is isolating from her. Did I do it well enough? Did I do it in a way that she is still healthy and she don't have the virus? And for me, that was the biggest issue because, alhamdulillah, I could feel that I was doing great. But what about those, my loved ones who are here and by me? So alhamdulillah, I'm the only one who had the virus and who became COVID-19 positive. My family and also my mom they are doing well, alhamdulillah, and they are negative.
Alhamdulillah. I must say that is so, yeah, it's a comforting thing to know that when you are positive, it is possible for the rest of your family not to get it. So talk to us about Ramadan, because of course it was a spiritual time, and we know you are just Ramadan in and out, through and over. So talk to us about what Ramadan meant to you. Where was your spirit at when you found out you were positive and you couldn't fast?
Subhanallah, me put it like this. It was the 4th day of Ramadan when I fell sick. And in a way that I felt sick that I couldn't do anything. I had all the symptoms, everything. From body aches to shortness of breath, fever, headaches, a loss of appetite. I had a loss of taste and smell, even had tight chest and had a problem breathing. And one last thing happened to me when I was in hospital was hallucinations. So it was the first week, I would say, of Ramadan that I said, no, I want to fast, even though I could feel I couldn't. But you know what? As a practitioner, you make all your different concoctions and mixtures, and alhamdulillah, I felt great, and I wanted to fast the next day. But lo and behold, when it came to the time of Dhuhr, I couldn't anymore. I had again the dizzy spells, shortness of breath, everything was there again. And so I had to break my fast. But, breaking your fast in the month of Ramadan, it really impacts a person emotionally and spiritually, because you wait whole year for this beautiful month of Ramadan. And when it's finally upon you and you become sick, it's like, subhanallah, Allah, are you testing me? Must I do better? Must I be stronger? What must I do? And literally, I felt it like, it's like, not a challenge, but I challenged myself to saying, look here, subhanallah, I must do better. I can fast. I must fast. I'm still young. My mom is fasting. Everyone is fasting around me. What's wrong with me? I do feel sick. I do feel ill. But what I can do better. And subhanallah, that was my breaking point. But you see, they only notified me that I was COVID positive. This was in the second last week of Ramadan. And literally, for that whole time, I did not know. I know I was sick. I know I had the flu, but this flu was different. It was completely unique to previous year's flus. So therefore, I needed to understand, is it? So I had to investigate, and that was by screening and testing to ensure, did I have the virus, or was it just the common flu that was just more severe and different this year?
Okay, we are taking your WhatsApp messages, questions, 063 595 0653. So Yusuf, you were in fact rushed into hospital because of your condition. You were in ICU. You had been on the oxygen machine or ventilator, was it the oxygen machine, for a couple of days. Tell us, what was your experience like, so people know what happens in the hospital with a COVID-19 patient?
Subhanallah. Okay. My experience was different to many of the people I met in high care, which they just went straight to high care. Because they didn't know my condition, I had to go to private, which was ICU, and that ICU was literally one bed for me and in a room which I had for myself. But the thing is that this room, which is C9 in Grooteskuur, in the new section, that is like literally radiation rooms where they monitor radiation levels. So it's a unique suite that I went to. But literally, subhanallah, being in, I would say, it was perfect experience for me to be alone. Because when I went into hospital, I stopped my treatment already 2-3 days before going into a hospital, because I wanted to have a true and honest result. It's not influenced by herbal medicine. So by the time I went into hospital, I felt drained. I felt weak. So I went in and they did the swab. That was here at Heiderveld Hospital. which they call now Twister, did the swab, and the minute they removed the swab from my head, from my nose, should I say, when they pushed it up into my nose, it came out very slimy and bloody. And literally, I just felt different, and I felt funny. And I struggled to go to the emergency room, and when I got there, I literally just fell onto the bed, and I said, I can't, I have no feeling, I'm feeling tired, I need help. So they came and did x-rays, and they were looking at the x-rays, and they said, I needed to be transferred to Grootskep. And with that results, that's what I got the next day, was that I had a COVID-19 pneumonia. That's what they told me, but they said it wasn't positive, so they had to wait another 8 days before I got the results. But when I went into hospital, my oxygen dropped down to 66, which they were very, very worried, because that's why I was experiencing hallucination, shortness of breath. I had literally I could just feel my body just shutting down. And that's where they put immediately the oxygen mask on me, and I had the oxygen mask for the entire 8 days. And for me, just having that on, having hallucinations, talking to people that isn't there, and having that experience of out-of-body mind experience, subhanAllah, it's on a different level. And that was the weekend, which I haven't told many people about. That initial weekend was, for me, the most horrific and terrifying time, because you feel your body draining, and you feel your body oxygen level. There's no oxygen going to your body, so literally you feel your body shutting down. And they needed to come and wake me and tell me, look here, your blood pressure went down too low, your heartbeat went down too low. You need to sit up, you need to move this direction, that direction. You need to cough. All those things the nurses came to explain to me. They gave me a whole lot of medication that woke me up, and I couldn't sleep for that 3 days. So for 3 days, not sleeping, having now also they even told me the Sunday, go and shower. And that day, I finished showered. When I went to the bathroom, I even urinated blood. So all those things were happening to me, and literally I just felt drained. I couldn't literally move. And so alhamdulillah, but by the Monday, the Tuesday, I started recovering and start fighting and start doing more exercise, doing activities in bed. And alhamdulillah, I was slowly getting better. But the initial weekend, subhanallah, horrific.
What an experience. Yusuf, shukran so much for sharing that. Please do stay online. We will be taking a short break and come back with your questions. Dr. Shuaib Wadi and Yusuf Mali, a recovered COVID-19 patient, is in studio and online with us. Please do stay with us. We'll continue just after this. Assalamu alaikum, very good evening. Welcome back. Don't forget to WhatsApp us your questions. There's quite a few coming through. We still have Yusuf Mali, a COVID-19 recovered patient who also had underlying condition, herbalist and media personality. So he is online. There is some questions that has come through, but quickly, if I could just refer to Dr. Shuaib to comment on what Yusuf has mentioned. He said a few things with regards to being in hospital, being on the ventilator or the oxygen machine for quite some time. 8 days, you couldn't be without it.
What he's describing is quite common. It's actually the experience of the majority of people who end up needing hospitalization. Okay. As I said, a small percentage will actually need to be in ICU on a ventilator, but the majority will need oxygen. Okay. And the only proven therapy that we have around the world now is time and oxygen. So there's lots of other therapies which are promising, which may help, where we're still waiting for evidence and we're still waiting for them to document that they do make a difference. But we don't have the details yet, whether they do. And people are trying things. It's not that they're not trying things, because some people continue to worsen. But at the moment, what seems to happen is that the virus attacks your body, and the percentage of people, it causes a severe illness, and pneumonia is one of the main problems it can cause. And that pneumonia causes your lungs not to function in a way where you can't get enough oxygen. And what Yusuf describes is exactly what happens. You feel tired, or you feel short of breath, and you feel like you can't breathe. And if you have the saturation, what he's describing the numbers, where he said his oxygen dropped to 66. The normal oxygen saturation of blood is 100%. That means if you're sitting here in a normal oxygen environment, even at altitude between myself and you, the oxygen saturation in our bloodstream should be certainly more than 95% and close to 100%.
So that's the causes of the hallucination.
But what happens is that if there's something wrong with your lungs, and there's a variety of different problems that can cause it, the amount of oxygen that your lungs are able to exchange and get into your bloodstream drops substantially. And that's one of the hallmarks of this condition, that some patients even feel okay, they don't feel too bad, but if you check the amount of oxygen in their bloodstream, especially if they're starting to get a pneumonia, it drops significantly. So even people who feel fine will have oxygen saturation sometimes in the 80s, and sometimes in the 70s, and sometimes right down to the 30s and 40s.
Sure.
So those people are really, really ill. So obviously the treatment is to give them high flow of pure oxygen. Okay. So they call it high flow oxygen, or high percentage of oxygen. The normal oxygen in the environment is 21%. So of the air, 21% of it is oxygen. But the idea is to give you a concentration of oxygen which is 100% of what you're breathing in, or close to it. And that then allows you to get enough oxygen into the bloodstream, even though the lungs are not working well enough. And then that buys time for you to do other things, or for your immune system to be able to cope with the virus and then overtake it. The problem with some patients is they develop what's called a cytokine storm, or an immune storm, where the immune system becomes completely dysregulated, and then it's actually the immune system which kills the person. It causes severe inflammation in the lungs, and you can't even get enough oxygen into the bloodstream with high flow oxygen. Those people need ventilators, and sometimes they don't make it. So the significant number of people who are dying of this cytokine storm, the immune storm, which then potentiates the damage to the lung and worsens it. Besides the lungs, it can affect other organs like the brain, the kidneys.
What was he describing when he mentioned about the medication to keep himself awake?
So, the medication is not really designed to keep you awake, but it's a side effect of some of the nebulizers and some of the other medicines they may use. Obviously, also, if your body is not getting enough oxygen, your body is panicking all the time. You're producing huge amounts of hormones. But do they want him to stay awake? So it may be better for him to stay awake, especially if his oxygen levels are dropping when he's sleeping. And he's right. We often will ask patients to turn around onto their tummy and onto the side to make sure that areas of the lung which may not be getting enough air into them, pockets of air into them, can get aerated, or areas which may have collapsed because of accumulation of fluid, that fluid can move around. So there's something called prone ventilation, which was practiced on a ventilator, but now we practice it even off a ventilator. We ask people to lie on their tummies for a little while and take deep breaths to open up those areas of the lung at the back and at the base, which can allow more oxygen to get into the bloodstream. And then to turn around again, it's not worth staying on one side. You have to keep turning it. So those are some of the things which we're doing to try and keep patients off ventilators.
Okay. So, Salam, is it true that you can get the virus only through someone's mouth and not in any other way? But why is the virus spreading so fast, especially in the Western Cape? And if people haven't come into contact with someone via the mouth, why are they still getting it?
So, the virus comes out of your mouth and your nasal passages, your respiratory passages, because it lives in the respiratory tract mostly, but it's also found in your stool and so forth and so on. But we don't think that's a major source of infection. We think most of the infection comes when droplets come out of your respiratory tract, and either they spread directly onto someone in front of you, close by. That's why we have this physical distancing concept where you're protected because you're far away from someone. So even while I'm talking, we know from some studies that small droplets are emitted from your mouth while you're talking, up to a meter away from you. Obviously, if you're coughing, it can go much further. And that's where masks and that come in to prevent you from pushing those droplets out into the environment. And so some of those droplets you will land directly on someone's face, on their mouth, on their nose, on their eyes, and then can infect them. Some may land on surfaces, and people touch them. And so the predominant way seems to be droplet spread, but there is some spread from surfaces as well. And it's possible, especially where people are coughing and sneezing, that some very fine droplets stay in the air for a little while and can spread a little further. Although it's not clear whether that really is an important mechanism of spread.
So wash your hands, don't touch your mouth,
don't touch your
face.
Wear a mask to protect others.
And to
around
protect
you.
yourself.
And then obviously, I think one of the things is if you're in a group of people, more than 2 or 3 people, even 2 people sometimes, you should try and avoid being in a enclosed space.
Yes.
Ventilation makes a difference because if there's air moving through, even if you're coughing or talking a little bit, some of that is being dispersed around the environment. So
okay, so someone mentioned Brother Yusuf used his own medicine. They asked did, and I know that he mentioned he did use some of his concoction. He's a herbalist, of course. What happens? Because it didn't help him with anything.
Well, there's lots of medicines which don't work. So there's lots of conventional medicines which have been tried as well, from antibiotics to the different antivirals, with limited success. And I think what's happening now is there is a couple of drugs which have shown some success in reducing the amount of time patients at hospital and how long they need oxygen. There's some speculation that some other drugs, if used together in combination with them, could save lives. There's some drugs which reduce that immune storm that I'm talking about, like cortisol and there's certain other antibodies, which if you give to patients before they develop that immune storm, can prevent the damage to the lung and so forth, which occurs, and maybe can keep them off a ventilator. But it's still early days. I mean, we've had some conditions like TB and malaria and the flu for decades and centuries, and we're still accumulating evidence about how to help and how to treat them. We've had this condition for like 6-7 months, and it's only really become a major issue in the past 3 months. So I think there's going to be a lot of new information and other information which we're going to have to gain and gather. There will be mistakes made, no question. And people will feel like they're guinea pigs. And it's true. Some people will be in a sense of the word guinea pigs because we don't know what to give them.
So it's interesting how things have evolved. When we were looking at it a couple of months, 2 months ago, it feels like weeks, which literally was, we were talking about prevention. We were talking about protecting. Now we have people messaging us to say that they've got it.
Yes,
they've got COVID-19. They need to quarantine. We were looking forward now to helping people.
So the world has changed. I mean, the paradigm at that time in early March, when we first had the first show, before we even had a case in South Africa, was that we need to prevent it coming into South Africa, and if it does come, we need to prevent it from spreading. And that really was the government's paradigm initially, was to contain it, to see if they can contain it so we don't have any cases or very few cases. In hindsight, the only way they could have done that was to close all the airports in January or December and not let anybody in or out of the country.
We've just got a few minutes before we take a break, Dr. Wadi. We're going to continue with this after this, but before we wrap up on this segment, I just want to hear from Yusuf. Yusuf Mali, you still with us?
Yes, I am.
Marv, we have to wrap up with you, Yusuf. Shukran so much for your time. We appreciate your story, your concluding comments, and especially around the fact that there is this surge of infections within the Western Cape, and some people are saying it's possibly happening at the local butcheries, the cash and carries, the grocery stores. I mean, in your opinion, is that true? Because that's how you've described you contracting it. And what would you say to people that, of how they need to protect themselves? Because, I mean, you're the only patient in the house. Nobody in your home got it.
Alhamdulillah, yes. I would use mask. And also type of, you see, many people think of the dust mask, just bandana, that is sufficient and that would help. I have actually been studying on it to ensure that understanding what type of mask. So it's the N95, KN95, those are the ones I would recommend, but the N95 is mostly for medical, but anybody can get the KN95. But now that's the mask aspect. And when you mention also now the part of the essential services, that is something as a journalist I pointed out to the minister in the early days and said, you are testing all the people, but what about the essential services? Those people who are providing that essential items that we need, have you tested them? They've got the permit, they're allowed to trade, but are they safe? And lo and behold, he said, no, we haven't thought of that. So alhamdulillah for that they have now looked at the essential services, but at that same time, I got ill, but not through the essential services, but through a customer that came in that was COVID positive. So that is another thing that we need to understand is social distancing, like you're saying, and all the other aspects that that accumulates and becomes the issue of becoming COVID positive. And as well, I do have a weak immune system, like the doctor pointed out. So that was part of that culmination of that perfect storm in which I suffered so severely. But alhamdulillah, out of it and doing better and going about my work as usual, alhamdulillah. And as a shukr for everybody for the beautiful du'as and all the sentiments, and also for you, Hawa. Shukr jazeela.
That's a pleasure. Keep well, Yusuf. We'll definitely chat soon. All the best and salams to the family, and keep that safe and follow the necessary rules that you are doing, because clearly you're doing something right if nobody else has it in the family. Alhamdulillah.
Shukran jazeelan. Shukran for the opportunity. Ma'as-salama. Ila al-iqa.
Wa alaikum assalam wa rahmatullahi wa barakatuh. That was Brother Yusuf Mali, our entrepreneur, father, husband, a media representative as well, and COVID-19 positive patient in the month of Ramadan, which hit him quite bad. If you'd like to be in contact with him, please follow his Facebook page. He's also a herbalist, and hear his story. But we'll continue the conversation and more of your questions. COVID-19 positive patients are actually contacting us. And after this, we speak to a patient who had, at least to a sibling of a patient that had absolutely no symptoms. Back in a moment. Assalamu alaikum. Welcome back. This is Health Matters. Remember, you can catch the repeat if anybody has missed it thus far, tomorrow again and over the weekend, inshallah. We are live on itvnetworks.tv and on our Facebook page as well. With me is Dr. Shuaib Wadi answering your medical questions with regards to COVID-19. So a viewer just posted, Assalamu alaikum, lost my husband 7 days ago due to COVID-19. The janazah we could not attend. And on top of it all, they didn't take fingerprints, and we have to wait for Home Affairs now, which means they never even had contact with the deceased husband. I can only imagine what they've gone through. Did anybody experience this, is what she wants to know. So please interact with us. Let us know if you had a death in the family, lost somebody due to COVID-19, and they didn't even let you know or even take fingerprints, but they're waiting on Home Affairs. We'll chat to Dr. Wadi about that. They're all positive in the house now, Dr. Wadi. So we'll chat more on that. But we've also got a medical doctor in the Western Cape online who is close with someone that had contracted COVID-19. In fact, he had a scare at his workplace. So the workplace had to close down, do the necessary, disinfection in the hospital. In the store, and then with that came the necessary tests that all the staff needed to do. And in fact, this individual never had symptoms, and he would not have had himself tested if the work didn't ask him to. So now let's chat to our guest online. Assalamu alaikum to you. Hello. Hello, doctor. Okay, so we're trying to get her back online, and she'll tell us her story and her experience. So, Dr. Wadi, quickly, with regards to this comment that had come in, asking anybody if they've come in contact with that, is something that you could relate to, have heard of? I mean, so this is one of the sort of tragedies of this whole epidemic, is that it's leading to circumstances which are completely abnormal in terms of how we deal with our normal processes in society. I mean, it's very important for a grieving process for a family to be able to say goodbye to their loved ones, to be able to attend the funeral, be present at the janazah. But because of public health sort of concerns, especially where people are positive and other people in the family are present, these people are not able to perform the janazah for their loved ones. And it's a common phenomenon. And obviously sometimes because of the difficulties with the ghusl, with the burial procedure, there have been challenges for the burial societies, to make sure they have sufficient PPE or protective equipment to perform the ghusl. Or if they don't have that, sometimes ghusl is not able to be performed. So different burial societies have had different circumstances around the country. And it exposes some of the stress points in our society. So burial societies are really
unbelievable boon in the Muslim community. These are people who really selflessly give of themselves, I mean, almost on a daily or regular basis to help others during this period of bereavement. They organize everything, they arrange the janazah, they arrange everything. And there are a small number of them. When you actually cut down to the chase, there are a small number of them, and these people are putting themselves right in the forefront to do that. And especially when it comes to ghusl for ladies and so forth, sometimes these are middle-aged or elderly ladies or the ones who are volunteering. There's no young girls who are doing it, and it's sometimes physically difficult, and sometimes they themselves are vulnerable. So as a community, we need to look and see where the needs are, and there may be a need for younger people to get involved in these burial societies to make them much more efficient, especially at this stressful time, so that people can get support. And then in that family, for example, where every person has been infected, that's not going to be a rare phenomenon. I mean, first of all, the person passes away often in hospital on their own because they're COVID positive and they're in the hospital and no visitors are allowed, and sometimes the family is
and
not
everything
there
is just heard about on the phone.
And then sometimes the body is not even brought home to the person's home. It's taken from the hospital past the house, in some way, sometimes to the house, and then taken to the
Okay, we've got the doctor back online. Thank you so much, Dr. Wadi. Assalamu alaikum to you, doctor.
Alaikum salam wa rahmatullahi wa barakatuh.
Jazakallah for your time. Just tell us the story of the person that you've been in contact with. As we described early on, had the scare at work, had himself tested, but also had no symptoms. What is your message with regards to that?
So I think, so it was actually a surprise to us, even though, I'm a medical professional, so I kind of knew that the possibility of him being positive was there. What surprised us was the fact that he was completely asymptomatic. I thought that perhaps he would develop symptoms later on, and that maybe his incubation period was just a bit longer. But the 14 days came and went, and he still, alhamdulillah, him and the rest of us remained asymptomatic. And so that's why the rest of us also did not need to get tested. And I think that this is, at the moment, it's not at the forefront of, where the research is pointed, because everyone is looking for treatment modalities and, focusing on a vaccine. But the reality is that there are patients that are completely asymptomatic. And to this date, we don't know how far they can transmit the infection while being asymptomatic. And of course, this is a dynamic situation that we are all in, and things are changing every day. Research needs to be done. And I think in the meantime, the basics of social distancing, number one, making sure you wash or sanitize your hands, wear your mask. I think those are, the basics that they've been telling us about since the beginning. And I don't think, even now as restrictions are being lifted, I think the public needs to remember that it still needs to be the main thing to protect ourselves from coronavirus, and by extension of family members that are at higher risk of developing more severe disease.
Shukran so much to you for your message, and all the best. And please keep doing the work that great work that you're doing, and informing people the way you need to. Appreciate your time. Assalamu alaikum to you. So there you have it. A very close family member of this doctor, knew the rules, knew what to do, knew what was going on. What is your message? Sorry, Dr. Shuaib, we've got literally a minute to wrap up. And also a family saying that, they are all COVID-19 positive. How do they practice self-quarantine?
So, I mean, if everybody in the family is COVID positive, they don't obviously need to isolate from each other because they're all infected. The challenge arises when some members of the family are positive and others are negative, to protect those who are negative from becoming infected. Obviously, government has made some facilities available for those who can't self-quarantine or who can't isolate at home. But there will be lots of challenges. There will be circumstances where one child is positive and the rest of the family is negative. How do you isolate that child away from their family, or where the mother and father are positive and the kids are negative? So those circumstances we're going to have to deal with on a case-by-case basis. Extended families are going to need to come in and assist each other. And I think we're moving, as I mentioned that at the beginning of the show, that we had this approach of trying to contain the virus. But now containing the virus is not possible. What we need to do is slow the spread of the virus so that everybody doesn't get sick at the same time, so that our healthcare system can cope for that small number of people who need to be admitted. If 100,000 people are all admitted at the same time and 10% of them need admission, that's 10,000 people who need to be in hospital, and our healthcare system can't cope with that. But if small batches are affected at a time, our healthcare system cope with it. Obviously, the flip side to that is it means that it drags out the period where people are infected. So it does mean that we need a prolonged change in our mind shift and our lifestyle so that we live with this for a long time to allow small people, numbers of people to be affected over time. What's very interesting, and what the doctor pointed out as well, and Yusuf may also want to think about this, and it was on your show there, your clip at the beginning, is that people who are positive may develop antibodies. And those antibodies are possibly protective. So that means they could protect them from future infections. But more importantly, it may be possible to harvest those antibodies in the form of plasma. So if the person who's recovered donates plasma, and that plasma is donated to somebody who's really ill.
That's a whole show on its own.
That
which we
could
can look
really
at.
make a big difference. So there's lots of trials to look at that as well.
Absolutely. So much more to look forward to with COVID-19. Shukran so much, Dr. Shaib, for your time. All the best. Rest well. We chat soon, inshallah. And from our team here at Health Matters, and know that there's so much questions around, and unfortunately we couldn't answer all of them. So, do I get it? Don't I get it? But first thing is to see that you are healthy, that you do not have underlying. Don't go and rush out to possibly get this, and then you find out you do have some underlying conditions. Go and check yourself out, and also, as they say, follow the rules, sanitize, wash your hands, do not touch your faces. From myself, Hawa Solomon, we have another update next week on Health Matters. Wassalamu alaikum and goodbye for now.